Thank you, everyone. We are, I think, in many ways going to continue the conversation that was starting there before we took our break. And many thanks again to Lee for what I thought was a wonderful and provocative statement of some themes. We're going to pick up those themes, and in this first panel, we're going to hear from a number of leaders, and I think it's safe to say in every case, a leader in a sector who is directly challenged and will bring their own perspective on the issues we've been talking about. That is, when they are making decisions about policy in the case of our federal colleagues, or guiding investment decisions of one of the nation's largest foundations in the case of Patrick, or in Anne's work looking across a whole field, what are they using as evidence? What are they thinking about as credible evidence? And as they look forward, what are they doing, or what would they like to be doing in their role to build the broader evidence base? Those are the twin questions we'll come back to again and again. Let me do very quick introductions. If you haven't noticed by now, there are bios of the presenters in your package, and I'd encourage you to look at those. But let me just mention who will be on the panel. Anne Kubisch is here as the director of the Roundtable on Community Change. And Anne, most recently in the Roundtable, have produced a wonderful book called Voices from the Field 3. I keep running out of them. The last version I had at HUD, and was talking, had the pleasure of talking at HUD with some senior staff, and Derek Douglas was there, and at the end of that he said,
I didn't take the book.
Derek Douglas said, you know, I don't have one of those, could I have one? So Anne gave me the look of, if you don't give him your copy, I'm going to kill you. Derek Douglas is in the White House. So there went my copy. We're joined also by Raphael Bostic, who is the Assistant Secretary for Policy Development and Research at HUD. And if you are following the very innovative work and very coherent work that HUD is doing around building neighborhoods of opportunity and making real opportunities for affordable housing for low-income communities, you'll know that it's on the cutting edge of what do we know and how are we taking that into innovative territory. Jim Shelton is the Assistant Deputy Secretary for Innovation and Improvement in the Department of Education. Some of the highest profile, highest cost, highest payoff, we all hope, initiatives of Race to the Top, I3, my personal favorite, Promised Neighborhoods, but just because it embodies so much what most communities' aspiration for their children are. But again, having to make decisions daily about what evidence do you rely on, and how in a program like Promise do you also innovate. And a good friend and colleague, Patrick McCarthy, at the president and CEO at the Annie E. Casey Foundation, who has made evidence and how a philanthropy, the nation's largest philanthropy dealing with disadvantaged or trying to improve the lives of disadvantaged children and families, how it can use evidence to build a long-term change agenda while retaining its reputation for innovation. So you can hear the themes as people think about this from different perspectives. And our moderator is Larry Aber, who I am going to read the title because as I was looking over this, I realized it is perhaps the most impressive title of any of us in the, so Distinguished Professor of Applied Psychology and Public Policy, the Steinhardt School of Culture, Education, and Human Development at New York University.
It's the longest. And there's an inverse correlation between length and prestige. So.
Those of us who have had the pleasure of being in any dialogue with Larry know he is one of the most incisive thinkers with very formed opinions. And I love the idea of Larry being a moderator because the game for the afternoon is watch Larry hold his tongue. And we have encouraged him not to do so Totally. So I'm sure it'll be a stimulating conversation. Larry, turn it over to you.
Thank you, Frank. And on behalf of all of this panel, again, it's just wonderful to be here to celebrate Harold's life and his contributions to this field. And the picture out there, for those of us who know him, just bring him powerfully into the room in many, many ways. So the conversation is a rich one and a good one. We're talking about striving for credible evidence. And Lee Shore set and Frank Farrow sent a very important paper our way. I want to begin by asking you in 4 minutes, 5 tops, for each of you to just say from your own work, because you make fundamental decisions about what counts as credible evidence every day in different ways, and also how to do this balancing that Frank was talking about, of stimulating innovation and using evidence to do it. What's your basic perspective on these issues? A couple of minutes of orientation from the points of view of philanthropy, of government at the highest levels, and from the research and evaluation community. And I'm going to ask you to go in alphabetical order. I already warned Raphael. So just the way you're on the 4 or 5 minutes, Raphael, you're up first. James, he gave me the $10, so he gets to go last.
So good afternoon, everyone. It's good to see you all. And I need to talk to my parents about this bee thing. It happens all the time. I'm going to give a sort of a different perspective on this, in the sense that in my field, I feel like there's not a lot of evidence, right? So the evidence base for knowing which policies work and which ones don't is actually quite thin. And that makes it hard to know what policies to pursue. And in our space, we know a lot about what the impacts of a state of the world is. So we can tell you what it means to live in a place of concentrated poverty. We can tell you the things that happen when you're in a poor school. Much, much less is known about sort of how you move someone out of a situation of the concentrated poverty, or how do you change that school to make it better or more effective, or how you change a community. I was having a conversation with our Deputy Secretary, Ron Sims, and he was saying, we don't have a definition for a healthy neighborhood. Right? We don't have a lot of really quantifiable things you can grasp to describe what our goals and our end states are. And so how do you know what the right policies are, and how do you know what you should pursue? So of course, I accept the policy job, right? And are faced with that challenge. And I would say in this administration in particular, we really did have to face that challenge. There was, right off the bat, a pretty strong emphasis placed on evidence-based policymaking, the importance of rigor and the use of knowledge and science to guide our policymaking. And so it's kind of difficult to have a conversation where you can say, well, we don't really have very much evidence here. So we had to appeal to other things. And what we've done is really, we've had 3 responses, I think, to the challenge. None of them fully satisfactory, but you do what you have to, and when you're faced with, you got to do something, you do it. The first is to really do outreach, right? So one of the things that struck me pretty quickly is that there are a lot of organizations, a lot of people who are doing things, but they're not often telling us what they're doing and explaining it in contexts where we would hear about it. And there are reasons for this. These are small organizations, they're busy, they're pressed, and they don't have time to step back, and we don't usually create time to do that stepping back. So we've done a fair amount of outreach to just try to figure out, what are people doing? Is there any evidence that those things have started to change even the interpersonal relationships? Because those are the sorts of things we need to understand. We've also been fortunate that I have some really good staff who have really embraced the notion of innovation, right? And have started to engage sort of a broad community about what it means to be an innovation. How do you know what an innovation looks like? And really try to have a conversation and detail what innovations are. So one of the things I'd love for us to do is have an issue called the innovation of the day. Right? We're on the website. You just listen innovations. And let the marketplace decide which ones are really effective or which ones might work, because in this context, it's quite difficult. You're okay?
I'm not sure.
All right.
It's not what you're saying.
Yeah, I hope it wasn't me. The second thing we're doing is we're trying to build more evidence. So we've built a partnership with the What Works Collaborative, which has been charged with actually trying to figure out what works. We've done, they've been successful in a lot of areas to help us think about and organize the understanding of that. And we've invested pretty heavily in doing more evaluations through our transformation initiative. And so we've put in motion a host of new activities to try to do evaluations so that my successor doesn't have the same challenge that I did. And then the third thing is really to think about, as we do programs, to change how we design them, and to be much more purposeful, and we're trying, so it's an imperfect exercise, about making sure that design includes evaluation as part of the undertaking. It's always more difficult to overlay evaluation on something that's already running than it is to just have it plugged in at the outset. And yet relatively few programs actually do this. And we fail all the time. So we just started an initiative where we didn't actually do the evaluation. Someone came up to me last week and said, "Are we going to evaluate these things?" I was like, we better. So we had to figure out how to do this. But there are a lot of reasons: political pressure, the speed, the pressure to get things out fast and be visible. Those tend to take priority in that context. But we are having some successes. So we have the Moving to Work demonstration that happens with housing authorities. We allow them to have flexibilities in how they administer the program, change incentives to try to get people to perform better, have better outcomes. And it was set up with no evaluation, none. So Wild West, everyone doing what they want to do. The Congress wants to know what has happened here. It hasn't made any difference. I tell them I don't know, can't tell. So that led us to change our policy so that any new MTW authorities now have to have as part of their application a pledge from a research organization that will do an evaluation of their system. So fundamental change, and I think that might be a model for how we move forward in terms of doing our policy making and in terms of our evidence building, because I think those are the important elements as we move forward.
Thank you, Raphael. We're going to have a lot of chance to go back and forth. Thanks to each of you in advance for sticking to 4 or 5 minutes for the first thing, because I know each of you could talk for hours about this. So, Anne, you're up next.
Okay. I think what I'd like to do is to talk about the origins of the Aspen Roundtable on Community Change, because it's actually relevant for the discussion and the topic at hand. Because in the early 1990s, there started to crop up across the country a series of what became known as comprehensive community building initiatives. And there was no central place where people could talk about them, share learning, problem solve together. But the National Academy of Sciences had, through the Board of Children and Family, had a group that was looking at effective services for children. And that group took this on. And there are several people in this room who were part of that. Peter and Lee and Harold was a part of it, and I think others in this room were a part of it. And they took on the task of saying, what are we learning about this new generation of community change initiatives? And they had very rich discussions between 1992 and 1994 within the context of the National Academy of Sciences. But as they wanted to try and distill these lessons and give them out to sort of a broader audience, the National Academy of Sciences said, nope, that's not what we do. There's not a strong enough evidence base about this. We're talking about an emerging field, and so we're not the right home for that. And so Lee Shore and Harold Richman had the genius idea of going to the Aspen Institute and saying, can we locate ourselves at the Aspen Institute as a place where we can sort of learn together about an emerging field about which there is not a rigorous evidence base, and there's new questions, but we need to have some forum for contemporaneous learning. And the Aspen Institute welcomed Lee and Harold in, and they co-chaired this effort until 2 years ago. And it's been a great ride. I want to also say we were founded really with 3 purposes, and one of them was to create this kind of community of practice among leaders in this field. And I don't know if we used the term community of practice in 1994, but we sure do use it now, and it's the right language for us to be using about a field that is so much in flux and where learning is so hard to sort of distill and grasp. We were also charged with trying to distill whatever evidence was being learned and to disseminate it, analyze it and disseminate it and give it back to the field. And we have done that in a series of publications called Voices from the Field, of which this is the 3rd that just came out last year. And then we were tasked with working on cross-cutting problems that these initiatives were facing. And not surprisingly, one of the first ones that came up in 1994 and 1995 was, how on earth do we evaluate these things? And we spent quite a bit of time in the mid-90s thinking about that. And there are some people in this room who were really important behind. They were part of the committee that ended up producing 2 books. Larry was part of it. Bob Granger was part of it. Prue Brown was part of it. Really trying to say, what is it about the mismatch between traditional evaluation methods and what we're trying to do in these comprehensive community building initiatives that we can talk about and that we can make progress on. And we talked about the problem of causal attribution and how difficult it would be to do a random controlled trial with community building initiatives. And even if you could do it, it's not feasible and not practical anyway. So how do we think about causal attribution? A second thing that we talked about a lot is we were able to identify the fact that part of the reason these efforts were so hard to evaluate was because the theories of change that underlay them were so poorly articulated that we hadn't had good theories of change describing what we intended to be doing in these initiatives that could serve as a basis upon which we could develop an evaluation. And then the third thing was, not only was that these initiatives were about much more than just programmatic interventions. They were about community building, capacity building, rebuilding the social capital of disinvested neighborhoods, creating community civic capacity. And people were at a loss about how it was that we were going to measure that and evaluate them, how we were even going to sort of what the elements of them were, much less how you could find indicators of them, and then how you could know them if you saw them and could detect change in them. And then having detected change in them, how would you know that they contributed to better outcomes for kids and families? So that was the work that we got started doing in this field. Do I have more time or not?
You have about 1 minute.
Let me just say about how this question of how we distill and disseminate lessons about what we're learning across the field in these complex initiatives has really been a challenge. And it's been a challenge because not only the evaluation methodological problems that I just talked about, but also even when there were evaluations of these initiatives, they were very one-off. They were attached to a particular evaluation. How do I evaluate my investment in this particular place? And as a result, it became very hard to generalize across the field. There was no standard set of questions that we were asking. There was no standard of measurement. And so even if you look at the evaluations that were produced, you couldn't learn that much about what was going on. So we found that if we wanted to do some kind of distillation of what's being learned across the field, we had to read whatever evaluations were there. But they were unsatisfying. You didn't learn that much from them. Most of the time they were about the very early phases and only the startup of the initiatives. And they weren't able to guide people who were doing the work on the ground. So that when we've started to do our cross-field distillations, we have relied on much more than just the evaluation evidence. We have done a lot of interviewing because we believe that a lot of the knowledge and wisdom, as you were suggesting, Raphael, is in people's heads, the people who are doing the work on the ground, and you have to figure out how to get that out of people in real time. We do focus groups. And so I was looking at this and I was saying, yeah, that's exactly how we did the Voices from the Field. We did program evaluations, other research that's relevant for this field. We looked at the theory and we talked to the practitioners and tried to pull those together. And then we did it, I have to say, we looked at it all through the lens of our experience, and that the authors of the recent book really said, how confident do we feel that we can say some of these things that we think that we're concluding from having done these, using this multi-method approach. And it was a good thing that Prue Brown was in the room, because she was rigorous. She kept saying, no, we can't say that. We can't say that. And I'd say, come on, yes, we can, yes, we can. She'd say, no, 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 we can't. So that's how we, and then in the end, we did this book, but then we also weren't, even then we weren't so confident, so we invited other experts in the field to contribute response essays to say, here's what we missed, what we got wrong, what needed to be added to it. And again, some people in this room, thank you very much, were respondents to that. And that's how we've been able to try and pull from a variety of different sources to say what we're learning in this field.
That's great. So we've heard from a major government official working on policy in a field where he feels like there's thin evidence and some strategies from him, from the research and evaluation community that works with local communities to evaluate and some of those strategies. We're turning to philanthropy before we get the cleanup hitter of another federal policy perspective.
Thanks so much. You know, I could just sort of sit back and listen to this, so it's daunting to be in this group and pretend that I've got much to add, but I actually have a few things that were triggered both by the paper and by even this just recent exchange. I want to start with Anne. You know, I think you did a great job of kind of explaining how we were actually, I think, mixing some apples and oranges here. If you look at the community development field, as Raphael said, we do not yet have enough experience, enough structured gathering of evidence to actually form a plausible paradigm to actually test and evaluate. Mm-hmm. We're in a pre-paradigmatic state mm-hmm. when it comes to community development work, in my view. And what that means, exactly as the paper says, if one were to try to structure a random control trial, you'd run against the problem that you don't have the theory well developed enough. By definition, these are saturation approaches, and so finding comparable groups, much less randomized assignment of them is awfully tough. And the initiatives themselves, by their very design, are extraordinarily complex. And the complexity itself makes it very difficult to do this. It doesn't mean it can never be done, it's just at this stage of development, it seems to me, the paper makes a good point and makes a good point. We're not at that stage. A couple other points about this question of what's credible. I'm tempted to go into credible to whom, but I won't. I think we'll get into some of that later. We've talked a lot within the Casey Foundation about relying on the best available evidence. And again, the paper talks about that as well. In some instances, the best available evidence comes from developmental research or brain research or sociological research. In some instances, the best available evidence, in fact, comes from rather rigorous randomized control trials, again, as the paper says. The real question is, how are you connecting, from the philanthropy standpoint, how are you connecting what you're investing in to the best available evidence? And it kind of begs the question, compared to what? Compared to what other evidence are you saying this is the best available evidence? Let me give you an example. There were 3 highly touted, often community-driven, well-represented, highly publicized, scaled-up interventions that were supposed to really deal with this horrible problem of juvenile delinquency. No randomized control trials, but lots of enthusiasm behind them. DARE, Scared mm-hmm. Straight, mm-hmm. and boot camps. Mm-hmm. Absent randomized clinical trials, we would not have discovered that all 3 actually do more harm than good. So I would suggest, and at least in the case of boot camps, a rather complicated set of interventions with young people. So I would suggest that we have to be careful, even as we don't over-invest in the notion that randomized clinical trials shall tell you everything. We shouldn't throw the randomized clinical trial out with the quasi-experimental bathwater or something like that. I know. Having said that,
I can tell it's dirty water.
Yeah, it's dirty water. Having said that, though, this notion of multi-method, triangulated approaches that draw on multiple sources of evidence is clearly the best way to go here. We've got to draw on qualitative research to understand what's going on in communities and families. Purely quantitative approaches won't give you that. However, qualitative research alone won't answer the question either. You've got to draw on multiple data sources, administrative sources, survey sources, normed instruments, interviews, et cetera. The more evidence you have, obviously, the more credible it becomes. A third point, then I'm probably close to my time, right? You know, I just have a challenge here as we think about this question of the difficulty of doing randomized clinical trials or other rigorous research on complicated initiatives. It begs the question a little bit about how careful we should be, especially when we're working in disadvantaged communities and with families that are disadvantaged, how careful we should be before we launch rather complicated interventions that don't have much evidence behind them that they work. Perhaps we ought to be a bit more modest or more focused in how we move forward. And final point, I think this whole notion of measurement, results-driven, recognizing there's lots of lessons to be learned beyond the randomized clinical trial. I mean, I think there's a whole lot of pay dirt there, but we got to marry it to the aspiration that we get to the higher standard of evidence and hold ourselves accountable to that. A lot more to say, but I think I'm...
A lot more, and we'll have time to say it. And Patrick, thank you. If it took Lee 9 months and Frank 6 months to get to her half hour, the lifetimes it took for each of you to get to your 5 minutes is deeply appreciated too. So, James, you're up.
So, there is a curse that goes with being last.
And you picked it, incidentally.
And I did pick it. So what I'll try and do is not cover some of the great points that have been already made, because the paper, one, was very insightful. It brought it all together, the things that we wrestle with every day in this work. Raphael pointed out very clearly the challenges that you face when you're trying to form policy in this context. Yeah, right. And in particular, there actually are two challenges that we face. One is that evidence bases are thin, and education is very similar. In my particular case in education, in areas where it's not thin simply because somebody happened to be interested enough to spend the money on the evaluations at the time. And so when you're trying to construct programs, for example, like in I3, which rewards strong evidence, you, by definition, are reinforcing previous behavior, not things that necessarily happen to work better than others. And I think that is often overlooked. It's overlooked as we move, as those who are most committed to this evidence-based policy, I think often overlook the implication that, in fact, by definition, they're reinforcing their prior mistakes and the lack of impact that we've had to date. Not a great thing to point out, but it's just true. So then there are two other things that actually came up during the conversation that I want to point out as parts of the overall challenge. One, which is the fundamental tension. How, when we actually are trying to build credibility around levels of evidence, do we maintain the flexibility, even when we are doing things that are discrete, for continuous improvement and doing the next innovative version of whatever it was that produced strong evidence? So, for example, in the current version of Promised Neighborhoods, the competition has some priorities around using technology to facilitate the social practices that are being deployed in the field. There's no evidence around any of that. But how will we ever get any if we don't try and identify folks that are going to try and take that on? There's a lot of pushback as we develop these programs on how far do you go in letting people stray away from the evidence previously and still get the reward of saying, hey, we're going to prefer your approach because it is based on prior evidence. I know I'm throwing out a lot of challenges. I'll come to how I think I reconcile some of this in a second, but I do want to highlight the one last thing that Patrick pointed out as well. Complexity in general. One of the reasons that HUD probably doesn't have many evaluations, and touched on this point as well, Patrick as well. When you put all these things together, the reality is the interactive effects render most of the prior evidence that you say you've got pretty irrelevant. I mean, I'm not an expert, but you guys correct me when I say something wrong. So how do we say with integrity that we're maintaining this high threshold of evidence when all of a sudden we start throwing together a bunch of stuff, and because each one individually worked, we say, great, you are much better applicant than the people who have a lower level of threshold of evidence on any given part of what they're proposing. So I want to highlight those points of tension, in some cases hypocrisy, in the work that we're trying to move forward, and then say, but the reality is that this is the job that we are all here to solve, to do. The most important thing that I think I bring to the work of the in particular the innovation agenda, as they call it at the Department of Education, is two parts to the definition of what innovation is. One is that it has to be significantly better than the status quo, right? And so, say, look, if you are doing something that is got the potential for scale, but is only incrementally better, then I would call that a trend. And if you are doing something that looks like it is having outstanding benefit in a single classroom, then it is a great invention. It is the combination of the two things that says you are doing something significantly better than the status quo, that can go to scale and can go to scale and be disruptive, that makes it an actual innovation. The reason that that's important is that almost never happens in one shot, right? And so when you are putting together the systems, what you're looking for is, I told the story while we were waiting, that the original name of the I3, the Investment Innovation Fund, is the What Works and Innovation Fund, right? And that when I first got on my job, and forgive me for those of you who've been in the room and heard this story before, but my first week on the job, I literally got a call on my second day from a senior staffer on the Hill that said, "We are so glad you're there. This is our big opportunity to take this program, do things that are way out of the box, really innovative, push the bleeding edge so that we can really find some breakthroughs." And on my fourth day on the job, I got a call from another senior staffer on the Hill that said, "This is our big chance. We're going to do those things and double down on those things that really have strong evidence, make evidence matter in education for the first time." And I said, okay, this is one program. How are we going to do this? And as I thought about it, though, it reflects how we need to think about the innovation pipeline. You start with many new ideas. You vet them. You try and improve them. You figure out if they have merit. You graduate them to the next level. You say, let's study it a little bit more deeply. Can it actually work at another level of scale? What are the contexts in which it works and which it doesn't? Okay, great. Work there. Let's graduate it to the next level. And you create a pipeline by which we can start to determine which things actually deserve to graduate to the next level. And hopefully, as we get more sophisticated and doing evaluation gets cheaper, which we should talk about, and more timely, we can start to figure out not massive interventions that work for massive populations, but we can also get very comfortable with the idea that some interventions are going to work discreetly for a certain population, and that's okay. Which is also a limitation of currently the way we define what needs to happen with our evaluations. So all that to say, there is a bunch of work to do in the design of our program, across what I would call all of the social agencies, especially those that do not have strong market factors driving them after the fact, right? So the reason that Health and Human Services has a lot of things with really strong, rigorous research is there is a huge payoff that's been there for many decades now for coming out the other end, having gone through trials to say that your stuff works. We don't have that benefit. There's no one who's going to get a big payoff when they get to the end of it except the broader public, and we see that that's not of interest to a whole lot of people these days. I'm sorry, I didn't mean to say that out loud. But the reality is that we've got to find a way to make the basic investment in these evaluations a part of doing business and the way policymakers think about developing programs. And so I'll close with my last 30 seconds describing my office. My office is the Office of Innovation Improvement. We run about 75% of the competitive grants in the Department of Education, most of them demonstration grant programs, 2/3 of which receive no funding from Congress for evaluation, for convening, for knowledge management. There are programs that have run for 7 years that we have no idea whether it works or whether it doesn't. We have done no mining to figure out what seemed like it worked or whether it didn't. And those are the demonstration grant programs. I'm not even get started on the formula programs. Okay.
Thank you, James. I think you see how fully this issue is engaged, and there's so many things to follow up on. I want to give each of you a chance to literally vote with your hand on one or two. I want to ask you one or two questions and just see how much agreement there is among the four of you on one or two of these questions, and then give you a chance to expand on it to some extent. So I think I have heard everybody on the panel implicitly or explicitly reject the notion that experimental evaluations are the only form of credible evidence. So just a show of hands, do all of you who believe that experiments are the only form of credible experiments are the only form of credible evidence, raise your hands. Okay. The reason I'm saying this is I think we should stipulate to some facts. I'd like to ask all of you to do the same thing. Would anyone like in this room to make the hard case, because I actually think Lee argues sometimes against the hard case when it's not quite necessary. So, but in this room anyway, would any of you like to make the hard case that experiments are the only form of credible evidence in our collective fields? Okay, so we've stipulated one fact, and I think Lee is right that there are some people who do, but they may be minorities. The second thing I want to ask,
but they sit in really powerful places.
In about 15 minutes, I'm going to give everybody a chance from the floor, but go ahead. You are moved, sister.
I am, because we hear from... Oh, sorry, thank you. I am moved because I work with a bunch of people who listen to a lot of people who are saying, we need the gold standard, we need the gold standard. And they actually don't understand that when they say that, what they mean is they're putting themselves in that box. There's a world of decision makers out there away from Washington.
Well, let me ask my next question then. Does anybody on the panel believe that we have sufficient rigorous experimental evidence about the things that you're concerned about, such that we don't need to invest in it again? Does anybody here in the room want to make the case? I know you. Quit laughing, Granger. Does anybody here want to make the case that we have sufficient experimental evidence to do that? So I think it's very important to get off the polarization on this in a certain way, because your response could be understood as they think that that's the only evidence. It is the gold standard. But finish the sentence. What's it the gold standard for?
I guess the point that I'm trying to make, I'm thinking in part of say some new philanthropists. They don't understand what they're saying.
Well, new philanthropists, yes. We'll stipulate that too.
But there are a lot of them out there.
No, but there are many new philanthropists who would never accept experiments as a gold standard. They accept the marketplace standard. So it really varies. Here's my point, and now I want the panelists to think about it together with each other. If we are not in a world where either we have experimental evidence is adequate, is the only credible evidence, and we're not in a world where we have enough experimental evidence to do what experimental evidence is designed to do, which is to get clear attributions of causality about some things. That's what it's there to do. If we don't have that, how do you all think in your work about strategically how to balance the research and innovation portfolio in that way without falling into the big muddy pit of this stuff otherwise? And just now let's go out of order. Who's moved first to reflect on that?
Well, for me, it's pretty straightforward. It boiled down to a very simple principle of a little bit of money for a little bit of evidence, a lot of money for a lot of evidence, and then how does that play out? Now, there are trade-offs with that. For example, complexity, as I mentioned, gets ruled out when you set the highest level of standard at, quote unquote, the gold standard. It just does. And so it makes complex interventions very difficult to qualify for the biggest interventions, and those things require usually more money. But in a world where you actually have a dearth of and a lack of incentives to create more rigorous evaluations, setting up that incentive structure makes a lot of sense.
Patrick?
So, two thoughts on this. One is, I actually believe that we know a whole lot more than we use. And when I say we know, what I mean is I actually think there's a lot more evidence from randomized clinical trials and other rather rigorous evaluation than we use in most of the social services, at least. I'm going to exclude broad community change efforts. But if you were to say what percentage of the total investment, federal and state, in, pick the easy one, why not, in juvenile justice, goes to things that we have any evidence that it works, and what percentage goes to things that we actually have quite a bit of evidence that it doesn't work, it's a no-brainer. There's lots and lots of research that would suggest developmental research. We don't have randomized trials, but it's developmental research, recidivism, anything you want to look at, that our current overemphasis on incarceration of juveniles doesn't protect public safety, doesn't get good child outcomes, doesn't even provide, in many instances, humane care. Lots of evidence. That's where the huge proportion of juvenile corrections dollars actually goes. We have, again, not enough evidence, but we've got a whole lot of evidence of other approaches that, in fact, get better public safety outcomes, get better child outcomes, are more cost effective. And so for me, the question of, do you invest in more evidence? Yes, you ought to, but I've got enough evidence so far to say, so why are we not taking these things to larger scale? And for me, that's where the innovation comes in. The innovation question is one of implementation, fidelity, and scale. That's where the innovations have to come in at least some of the areas in which we're working. Not all of them, but in some of the areas, how do you take what we know gets better results, not a magic bullet, but gets better results than what we usually do, and take it to a large enough scale that it pushes out the stuff that doesn't work.
In about 5 minutes, we're going to turn to you all. I thought you were going to go one place else with that, Patrick, which is we also have enough evidence to end practices that we know are non-effective. I know that's a concern of yours. Just say a word about that, too. It builds on your criminal justice idea.
So I'm trying to figure out how to do this quickly. So if you've got large systems, child welfare, juvenile justice, mental health, education, not necessarily equally bad at doing things that harm kids, but if you've got large systems investing huge amounts of money in things that don't work, you're not going to be able to invest in things that do work unless you stop doing the stuff that doesn't work and reinvest it. And that's what I mean by the innovation. The innovation question is, how do you do that? How do you transform systems? Some of it is basically systemic reform, and other is sort of financing reform. How do you do it in a way that makes room for the other things? But you've got to generate the public will to say, enough. After 150 years, these institutions don't work.
But I actually think that you're talking about a very narrow slice of the policy world, in the sense that you're emphasizing places that are research mature.
Yes,
that have
exactly.
Relatively research.
Well, if you know that things don't work, that sounds mature to me. So, I actually think that we're pretty mature on these things. And,
okay, cool.
And so, I guess
I'm glad to know your standards are so low. I'm kidding.
I guess for me, the question is, for the rest of us, where we don't know those things, sort of how do we start to decide what credible evidence looks like, and what's the standard that we should be seeking? And I think that was what you were reacting to, that in many of these places that are less mature, talking about a gold standard means that we're not going to be able to do anything for 10 years. I mean, if we really hew to that closely, and that's not an acceptable policy response. That's not acceptable for us as we go forward. And so in that context, what are we going to do to try to round out the information and squeeze out little insights that can help guide us as we design things? And that's art, in a lot of ways. That is talking to a lot of people, it's hearing a lot of things, it's seeing small changes.
So can I make a friendly amendment to that? It actually is not art, it's actually management. I mean, it's
that's art.
But people have been managing organizations to specific outcomes for some period of time. Most organizations in the world actually have to make decisions without the benefit of rigorous study in order to figure out what they're going to do next. They build systems to collect data to tell them whether they're performing against their outcomes. They have what they call strategies, what we call theories of action, and all that theories of change and all that good stuff.
One amendment to that.
Go ahead.
Which is that
And they work for the same guy.
Which is that the management has got to be to an understood mission, right? And
Agreed.
In many instances, what we're talking about is not viewed as part of the mission, is viewed as supplemental to the mission. And that is difficult. So, you know, one of the reasons why people don't report out on these things, that's not in their performance evaluations. Like, how many people did you tell what happened? We don't put that in our evaluations of our executives for these organizations. And so it just doesn't happen. So, yes, management, if the manager knew what it was they had to do, included this stuff. So that would be my moment. It doesn't sound like you're going to accept that one.
No.
No, and you guys are going to be able to talk about it again in a couple seconds. I want to do two things. I want to first call out that while Lee and Frank, in my opinion, raise the issue of the use of evidence fairly frequently in the paper, the use of evidence, in a way, is relatively underplayed, and a lot of the weight of the argument is on the nature of the evidence and preparing evidence for use and what kind of evidence is good for use. I think this dialogue raises the possibility that we need at least as much focus on the use of evidence, and that might change the collective understanding about this, because as little as we know about what works, we probably know even less about how to use what works effectively for management or art or going to scale or making the kind of big changes. So I think there's those two agendas. I'm going to give Ann a last chance to say something on the panel before I open it up for you, if Ann wishes to.
No, I'll pick up on that point and add a little bit to it, which is that, again, I look at the comprehensive community building initiatives. When we look at how, we as a field are disappointed in what they have produced over the course of the last 20 years. And when we look at why, a lot of it is because they weren't able to implement a comprehensive community building agenda in the way that we had sort of designed it in theory up front. And they sort of drown under the weight of the comprehensiveness agenda. They get too diffused so that they don't get enough dose to achieve any kinds of outcomes for anybody. And so I would like to suggest that we do need more rigor in figuring out how to implement some of the complex, or even some of the sort of narrower programmatic things that we're trying to do in different kinds of communities that are low resource, low capacity communities. We really have to figure out what works to have these things implemented in a way that's powerful enough to produce even programmatic outcomes, even narrow programmatic outcomes. And the second kind of evidence that I believe we really need to be more systematic about is understanding what we mean by community capacity. And I think that we have been, as a field, totally remiss in trying to figure out how to study this in any kind of a systematic or rigorous way. When you look at the initiatives that are going on across the country, they talk about community capacity, and there's a little bit here and there's a little bit there, but we don't have a way to study that systematically. Yet, I think that one of the things that has come out of the last 20 years of work is a better sense of what we mean by community capacity. We can disaggregate it into its component parts of leadership, of social capital, of civic capacity, of ability to organize a neighborhood, to develop a plan, to use data, to develop a mission and a strategic plan for itself. We know, actually, we've developed a kind of better theory about what we mean by community capacity, and it is now time to systematically try to understand that in various kinds of communities. And if we don't get a better sense of that, we're never going to be able to figure out how to implement effectively. And I think we're ready to do that work.
Could I just say one last thing? It's interesting. It is two sentences. The ability to implement, the ability to measure, and the ability to manage to results have to all be in place and at high capacity before you can evaluate.
Yes, because otherwise we don't get enough of an intervention. We don't get dose.
Right. Fantastic. Their generosity and discipline means we can engage everybody now. I'm going to take 3 questions at a time, and then I'm going to give each of you a chance to respond to one of them. So.
So here's what I've been struggling with, the whole issue of going to scale and what does it really mean. And I think there's a real issue here about, we look at programs that are there to address at-risk populations, and we say, can that go to scale? And I'll use the example of home visiting. a home visiting program, if we are really effective, each of the participants will do well. But that doesn't change the pipeline of people who are getting into the at-risk category. And so what does it mean to go to scale with home visiting programs if we're not talking about this kind of pipeline that gets people at risk to begin with? And what I think about is this dual focus on universal, what's needed universally to make a difference, and then what are the tiered services you need when people get into those at-risk categories and go beyond at-risk. And I think that conversation I'd love to have with folks, because I think that's a way of teasing out what does it really mean to go to scale. And I would suggest that it's different than we have often been thinking about it.
Thank you. And you don't have to ask questions. You can make comments, and then people can choose. But tell us whether it's a question or a comment. Who's next? Janet.
It's a question.
Yes.
Lee was talking earlier about trying to articulate the, oh, thank you. I have a loud voice, so I don't think I need it, but I know this is being recorded. Lee asked us to think about the essential ingredients of some of the work that we're trying to do. And I want the panel to help us think about both the nature and use of the new research that has come out on school improvement from the Chicago Consortium, the Consortium on Chicago School Research, where Tony Breik and his colleagues articulated 5 essential ingredients of school improvement. I see Jim shaking his head, so maybe you'll comment on this. But I think that that research has really important implications for what we're considering today. So I'd love to hear the panel's view about both the nature of that evidence and the possible uses of that evidence of the 5 essential ingredients of school improvement.
Thank you, Jan. Next.
Hi, thanks for your comments. Kirsten from Lyft. So since part of what we're talking about is wanting to get things done and change policy and move our country forward, it does strike me that so much of the barrier, particularly when we know in your juvenile justice example about what doesn't work, I mean, is recognizing the political side of this and the fundamental role of emotion, media, and kind of public understanding of these issues as probably far more of a driver of policy and programming than evidence. So just would be curious on some thoughts about how we connect those pieces of the puzzle into the evidence conversation.
That's great, thank you. We're going to come back for some more, but so 3 issues. One issue, a comment on an issue of scale and distinguishing universal and tiered and how you think about that. 5 essential ingredients of school improvement, and then in terms of getting things done, actually your question is a version of the question I asked you all about in this world of conflict between values-based policy and evidence-based policy, where emotions and media and politics and all that kind of stuff influences things more than media. How do we think about that? Who wants to take on the scale, universal tiered issue?
I'll talk about the
Raphael.
scale.
Yeah.
I actually don't think I agree with your statement in the sense that I think there are multiple ways that you can go to scale, and you were really highlighting the points in the life experience when you can try to do an intervention, but you can go to scale at both, right? So you can have an at-risk experience where people are already in the at-risk state, and then you can think about trying to prevent them from getting into that state. And I think you can go to scale in both areas, and you know, a lot of what we do and a lot of the conversation is about the once you're in the at-risk situation. But there's this more fundamental thing that if you do prevention, in the long run it saves you a whole lot of pain and all that stuff, and people will wind up better off. But prevention is often tougher, it's longer term, it's more complex, it has a much richer sociological aspect to it, and that's where people start to get uncomfortable, right? So it's like I can treat a clear symptom that I see today, but to sort of go back and diagnose how we got there is so hard and so complex that doing that well is very difficult. I think what these guys are doing with the promised neighborhoods and what we're trying to do with sort of the neighborhood revitalization is to say we've got to go back to fundamental building blocks and see how we can fit these things together to try to get to that preventative environment. But it's very difficult.
Good. Okay. James, you want to start on the 5 ingredients?
Yeah, so for those who aren't familiar, Tony Bright and the folks from the Chicago Consortium did a really interesting piece of work doing a controlled study, basically, looking at schools that took a variety of aspects of strategies to school improvement, ranging from the strength of leadership to the level of community engagement to the focus and clarity of the instructional approach in the school building. I won't go through the whole framework, but then basically through the analysis looked at the level of success in turning around the schools and identified really, really strong correlations between these 5 things and the success of the turnaround, in particular in schools of high poverty and high concentrations of students who are underperforming. And those 2 things actually matter a lot. And the interesting thing about it is that it's the intuition that many of us have been playing out for years and years, but it has provided a level of evidence that makes it much easier to engage in conversations about something that, to start to get to the other question, is a very difficult political discussion. When you say, the reality is, when you were talking about a school that has been failing for a long period of time, which in many cases, the very bottom performers have been bottom performers for a long time, you are not going to get there by a piecemeal intervention. It requires a comprehensive intervention, which usually means a significant amount of disruption, which usually means lots of difficulty in politics and, in some cases, not compromise. And so this is where the intersection of politics and evidence come together, where point of fact is that it was very interesting when we had the conversation with folks, because I participated in one of the original panels where Tony rolled this out, and there was a group participant there who was very anxious to talk about how our SIG model, which was our school improvement model, precluded these kinds of strategies, and so therefore we were absolutely wrong. I was like, well, actually, we do demand some things, but every single one of these approaches allows for, and in fact encourages in the language, people who are taking as a comprehensive approach as possible. And so the interesting thing about it is that our policymakers aren't making decisions based on reading our evidence-based studies. But they do ask questions. And so if you can find ways to leave the space for, and then the argument for, and then create the supports for, the policy to move in the direction that you want to go, and then provide the context by which people pick up on the things that are most likely to work, I think we've got an opportunity. But we still are going to spend a lot of money on things that people feel really good about that don't work until we build a very different culture than we have today.
Great, thank you, James. The issue in getting things done, recognizing the political side, the role of emotions, the media, public opinion as drivers in this area. Patrick or Ann, either of you want to weigh in on that issue?
Yeah, I mean, I suspect we both might. I mean, what I'm reminded of is the classic theory about government that says it sort of swings among 3 things that are in tension. The sense that what we need here is a strong leader, an executive who will just come in and make decisions and move things. The sense what we need here is more participation, more democracy, more balancing of different interests. What we need here is better technical solutions. Those 3 things are always in a little bit of tension. And what we're talking about today is mostly the last. That is data, evidence, et cetera, that a technocrat would say, if you do these things, things will work and it'll be fine. We live in a culture, in a country, and I think it's a good thing, where that's in tension with some of the things that folks have already mentioned. Well, what about community folks who say, well, you know what, my brother-in-law has a great program, and I don't care if it's not evidence-based or not, I trust him more than I trust you pointed-headed folks coming down from academia to tell me what we ought to do that. So I mean, I think that stuff is always in tension. Having said all that, the more we get out into common parlance, and the more we get engaged with the key decision makers, executives if you will, or lawmakers, with as much evidence as we can, we will begin to shape. We will not never ever, nor should we, control, but we can continue to shape the conversation. we were successful in basically getting rid of boot camps. Sorry that it's a narrow thing, but it's one example. Getting rid of boot camps because we had the evidence that they didn't work. There is some examples, much broader, for example in Washington State, where they're bringing in lots of different evidence, start to shift how we think about problems. It's not a straightforward thing, but it's worth the effort to contribute to the conversation and thereby affect the values that really are driving a lot of the decisions.
But it is more than just having the evidence. And,
oh yeah.
And the thing that I get frustrated with researchers about more than anything else is sort of a visceral disdain for PR, for spin, for trying to couch the results in ways that everyone can embrace and understand. So we're spending a lot of time right now with our policies trying to figure out how we can say and get the message across in the simplest way possible, where someone can look at one sheet of paper and get the message, right? They're not going to read 30 pages. They're not going to, and it can't be a table of regression results, right? It has to be things that are accessible. So, because the way that you overcome the political barriers is to create a different shared understanding, a different collective understanding. That's non-technical people, right? That's all non-technical people, and we've got to engage them. So I think that's exactly where we need to spend some time. And it gets to your issue of how do we use the evidence to advance policy.
Great, thank you, Raphael. Ann? No. We have 5 minutes left in this session, and I know there were a few other people who wanted to ask a question. I also prepared a last question for the panelists. So the panelists are going to simultaneously answer, if they choose, your last question or two, but also I asked them to prepare one hope for where it would be in 5 years with regard to progress in knowing how to improve outcomes for children, families, and communities. If they had one hope, what would it be? And so I'm going to ask them to respond to that in a sentence or two, but I'm going to ask them to consider instead answering your question, if you still have one. Ma'am. Yeah.
Hi, so I have a question. You had asked, is anyone in the room going to support the gold standard, bar none? And no one raised their hand, but there are plenty of people, researchers, that feel that way. And so what do we do when we do a formative evaluation or some sort of assessment that proves practice along the way and gets results and doesn't cost $10 million? What do we say when those people say it's selection bias? I mean, what do we do? I don't know, but it would be helpful to hear.
Okay, great. Effective response to the notion that experimental evidence is the only evidence. Yep. Can we get a microphone over here for this young man?
I'm not that young.
You're not that
pretty young. So we've been talking a lot about outcomes for children and families, and I'm really interested in kind of disaggregating outcomes, disaggregating systems. I know we're talking mainly about the same families, whether it's juvenile justice, whether it's child welfare, early childhood, but aren't some outcomes easier to achieve than others? And so take, for instance, pollutants in water and air that are, lead poisoning and asthma. Is it easier to move those levers than it is to get kids ready, for third grade level reading, for instance? Or
Ralph Smith thinks it is, yeah.
Is it easier or harder to make sure that a 16-year-old is not involved in the juvenile justice system as opposed to graduating from high school or going on to college? And are there implications in terms of kind of social justice and change if we're looking at what might be considered lower-hanging fruit? Are we being ambitious about outcomes that might kind of help move people out of poverty as opposed to just alleviating the state of poverty?
Thank you, Andrew. We have one last question.
This is sort of a combined comment question. I'm also a Fed. So one of the things that I struggle with in federal programs is, you had touched on this earlier, is about the value of sort of simple performance metrics and some measures that we can look at in real time. And there seems to be real resistance to doing that for whatever reasons. I'm not going to try to understand all of them. And a nervousness and a trust issue on the other side of there won't be room if we see things aren't going the right way to make the improvements. That'll simply be used as a rationale to cut funding or whatever. Or the other sort of pushback that we get is, well, that's not causal because you're just seeing. So it's the other side of that argument. And I guess, what do you think, or can you comment a little bit on the role of those in federal programs and how we can encourage better use of those which seem to be efficient ways of moving in the right direction?
So I'm embarrassed to remind us that we have 30 seconds each, but that's the spirit of the day. So anything you want to say in the last couple sentences, because we have another great panel.
Oh, you're all looking at me, so we'll go down this way?
We'll go down that way.
So one hope is what I'm going to choose to go with, because these questions are too complicated.
They're great questions. They're great questions, and I'm glad they're on the floor.
But I would just say it would be huge progress if there were several places where we had implemented a full continuum of evidence-based programs that were sufficient to show population-level results. That's what I mean by scale, is the results, not the programs. So if we had some examples, neighborhood, school, system, of population-level results due to the implementation of evidence-based programs.
Fantastic. James?
My hope is actually related to the two questions. The first part of it is that we get a lot better at segmentation in general, so much more discrete about how we think about the application of our evidence and how good we feel about working with parts of the population. The second is how the evidence is actually used and how the different levels of evidence are used. And so I picture it in terms of actually a very simple, almost, picture a website, right, that has, interventions on it. And it also has a rating scale of the level of evidence that we have that it works. It also has contextual feedback from people who have tried to implement it. It has whatever data those people have collected across a set of fairly common metrics of performance indicators in that particular area of study. And so that it becomes what in any other sector would be an industry report on how things progress. And then people can use applied judgment to decide based on the level of evidence versus the potential impact versus the feedback from others, whether they use it or not.
Thank you, James. Raphael?
I like that hope, and I actually think that's doable. So we should all write that down and see if we can make that happen.
Thank you, Raphael. No, I'm kidding.
I'll adopt that hope. Okay. This is on the record, right? So I guess the one thing I would hope for is that we did more non-siloed research, that we were looking for better understandings about how joint interventions can actually make big differences, or maybe not. We deal a lot in terms of choices of what we invest in without thinking about if we make some investments that may have spillovers in other areas that make these things have more value added. And there's woefully little there. So trying to build an evidence base there is where my hope would be.
Thank you, sir.
I'll sign on to all of those things and say that I really do think that we're poised to have much better research done across the United States about capacity, community capacity, capacity to implement. And so I want to sign on to all of those things, because I think what we need is a demonstration research project on building community capacity, what it looks like and what kinds of outcomes it produces. And I think that Larry Aber should run that demonstration research project for us. That's my hope.
Because you believe in the Peter Principle.
That's it.
On behalf of all of us, let me ask you to join us in thanking our presenters. I think that you all did a great honor to Lee and Frank's paper by really plumbing it. You all did with your questions. And Harold thanks you as well. Thanks.